Okay, so today we have Gloria, and she's 75 years old and has chronic back pain. Her symptoms are aggravated when she's standing for over 20 minutes and also walking for over 20 minutes, and she gets a lot of relief from flexion of her lumbar spine and also from sitting. It's pretty immediate relief. She doesn't have any acute injuries, anything like that, so it's just her pain is flared up, and so she's a really good candidate for mechanical traction. Some of the contraindications for that are, like I said, acute strains or sprains, acute inflammation, pain that's not provoked by movement, and also if traction were to cause peripheralization of her symptoms, and any spinal implants like a spinal fusion or those kind of surgeries. And so we're gonna go to our patient now. How are you doing today, Gloria?
Good.
Good. Okay, so what we're gonna do is we're just gonna hook you up to this machine over here, and it's gonna provide some distraction. It's gonna pull your spine apart just a little bit, and it should relieve quite a lot of your symptoms. Does that sound okay?
Yeah.
Okay, so we're just gonna put this on first. They weren't attached together. There we go. So start here. And then we're gonna that one. Does that feel too tight?
Mm-mm.
No, okay. We want it to be pretty snug, but you don't want it to feel too tight. And then we're gonna put the second one on. So just watch your hands. Okay. That one feel okay too? Okay. So I'm just gonna clip this belt up to that ring there. So if you might move your leg. Good. So this goes right here. And then I'm gonna just put this bolster under your knees. Just there we go. And you can lift that other leg for me, just like that. And we'll stick that right there for now. Okay, and now we'll come over to our machine. Okay, and before I start doing anything on the machine, I'm just gonna give you this kill switch. Okay. And so if you feel any additional pain or your symptoms get worse, I want you to make sure to push that, and so that will turn off the machine completely. And it might feel a little weird, but you definitely shouldn't have any pain with this treatment, okay?
Okay.
Okay. So we can start here. And so with this, we've chose to have her supine because she has a muscle spasm, and also the pain is more posterior with the facet joints, and so that is why we have her in the supine position. And so that is for the posterior protocols there. And what we're going to do is, normally we could go up to 20 minutes, but just since this is our first time, we were gonna be a little more conservative. And we're gonna do manual for this. And we'll do 5 regressive steps just so it lets off slowly. And then we also need to make this so it is, there we go. Doing okay?
Yeah.
Okay. All right, and we're just gonna do intermittent here. We'll hold for 45 seconds. And then we'll let her rest for 15 seconds. That'll be our minimum force when it lets off. Okay. And Brooke, normally this is 50% of your body weight. And so do you mind telling me what that would be?
130.
130. Okay, so half of that, if we can do math, is 65. Okay. Yeah, we can do math. All right, and so we're just gonna slowly start this right here. So let me know if, are you feeling anything yet, Brooke?
Just a little pull.
Okay. Nothing uncomfortable?
Nope.
Okay, so that's where I'm gonna start it. Do you feel okay there?
Yep.
Okay. Alright, and so we went ahead and started. You should feel a little bit of traction there, but nothing uncomfortable. So everything feels okay so far?
So far, so good.
Okay, perfect. And gone about 20 seconds, so for the purposes of this video, we'll just go ahead and stop it. And it's just going to slowly release her off that traction with the regressive steps. Okay, and we're just going to do that. And then we'll start to unhook ya. Okay, and I'll take that switch from you. And how are your symptoms now, Brooke? Do you have any pain?
No, I feel so much better.
Great. Okay, I'll take this bolster from you. Alright, you can slowly sit up. Okay, and everything still feels good?
Feels great.
Alright, then you should be all set.
Thank you.